relationship between endometriosis and fertility is somewhat complex. Various guidelines suggests, however, certain criteria as to how to deal with the problem. Endometriosis is a fairly common condition. Almost 176 million women worldwide is affected with endometriosis, it's estimated. Endometriosis is a condition where little elements of the lining of the womb, the endometrium, can be found elsewhere outside the womb, most often in the abdominal cavity that is inside the tummy. Because they are the same tissues as the lining of the womb, they also bleed when one has a menstruation, one has a menstrual bleed every month, and therefore blood inside is an irritant and causes pain during the periods mostly to start with, but eventually can become more chronic. There can also be scarring inside, leading to damage and blockage of the tubes. The primary symptom that endometriosis causes is pain, and pain can be during menstruation, during intercourse, at other times during defecation, which is passing stool or passing urine. And quite often, pain does not correlate with the extent or the severity of the disease. A doctor, a gynecologist, may examine to feel for endometriosis and its signs. In most cases, one would do an ultrasound and sometimes even an MRI. But the gold standard still remains for diagnosis and for treatment of endometriosis is endoscopy or laparoscopy, namely keyhole surgery, at which time either the endometriotic tissue is burnt or better still excised and sent for a biopsy. However, with regards to fertility, surgical treatment has its pros and cons depending on the extent and the type of surgery. There are drugs, non-hormonal, to help with the pain, or hormonal preparations that can suppress the endometriosis and help with the symptoms. Unfortunately, hormonal treatment cannot be given if one is trying to conceive. Surgery also occasionally can be harmful, particularly if extensive ovarian tissue is damaged. 25 to 40% of infertile women probably has endometriosis. Endometriosis may affect fertility in women in three main ways. One, it may affect the quantity of the eggs, the ovarian reserves, either directly or in particular if it causes a cyst called endometrioma on the ovary, and in particular if that endometrioma is being treated depending on the type of and extent of the treatment. It can also potentially damage the tubes by causing scarring and blocking the tubes, and it probably creates a toxic environment for implantation. However, that does not mean that anyone who has endometriosis, and in particularly minimal or mild endometriosis, will be affected with fertility problems, and therefore one should definitely try to conceive naturally, at least in the first instance. If one gets pregnant, it is unknown whether endometriosis has any harmful or deleterious effect on the pregnancy. Probably it doesn't. The bottom line, therefore, is that even if one is suspected to have endometriosis or mild endometriosis, one should try to conceive naturally in most cases, particularly if one is expected to have or diagnosed to have mild to minimal endometriosis.